Hey, I am Dixie Wetzel, and I am a retired IBCLC. Have taught the lactation education courses in this program, helped start the program initially, and now I am the advisor in the program and no longer teaching as I kind of slowly but surely move out. So, and I get to do a lot of the PR and get to do fun things like this. So, yeah, glad you're all here. Rachel, take it away.
Yes. Hi, and I'm Rachel Martinez. I'm the clinical instructor for the program. So after you would take your education portion of the program, when you apply to the practicum, then I would be your instructor for the year and guiding you through your clinical experience.
Great. Well, welcome everyone. Dixie is going to be the official MC today. Be sure and drop questions into the chat. Let us know what you want to know either from us or from our speakers. Realize we're recording, so if
Oh,
all right.
okay, so I missed the last part that you just said. Sorry, you froze for a second.
Oh, I'm sorry. I just said we're going to make the recording available. So if you miss a statement, you'll have access later.
Great, great. So just to kind of review for everybody what we're going to do during this webinar is we have a group of wonderful speakers here, and each one of them is going to introduce themselves, just tell us briefly how they became an IBCLC, what jobs they're doing now, and how they're using kind of their lactation skills in those jobs, and then maybe some joys and challenges in those jobs to give us some different kind of snapshots of different kinds of things that lactation consultants do. And we'll probably be able to take maybe one question from the audience after each person and then move on to the next person. So you get a really nice variety of ideas about the kinds of jobs that folks can do. And then after that, we just have a few slides about the program. We're happy to answer any more questions folks have. We do have two speakers that are on the East Coast, so they will probably want to leave early. So it's Maria and Nadej. So if you have a burning question for one of them when they're speaking, be sure and drop it in the chat or raise your hand and let us know when they finish speaking. So let's see. So I think we're just going to go around and start with those East Coast people. So Nadej, do you mind starting?
Sure, I will start. So hi everybody. So I live here in South Florida, and a short background, a quick background on myself. I am a foreign medical graduate, so I moved in the United States, trying to get into medical residency. It was very challenging because it cost a lot of money. It's very competitive. So although I passed my exam, I wasn't able to make it to residency, and I started working in doctor offices as case manager. I enjoyed the job at the beginning. Although I like talking to people, I always wanted to be a teacher. And after a while, I realized that I couldn't feel the impact that I was making in a direct personal way. And it came to me that I wanted to do something different, but I didn't know what it was. And I wanted to use my medical background. I wanted to be able to apply all the skills I had. And turned out in 2021, a friend of mine, a pediatrician, sent me an information about an IBCLC. At that time, I had no idea what that was, but I looked it up, and turned out I was very interested because in my personal life, I breastfed. I was always a natural advocate of breastfeeding, and I was working full-time at the time. And so looking through programs, and I found PSU all the way on the West Coast, but with the difference in time zone and the availability of the program that I could do remote and virtually. So I got into contact with Dixie, and that was in October or November 2021. In January 2022, I started the program. And immediately I realized how much I did not know. I learned so much through the program. And I encountered a lot of challenges, but really the faculty, they really supported me throughout all those challenges. And one of the main one was finding a clinical site when I was done with the first part of the program to enter right here in Florida. And Michelle, the program director, was able to find a hospital where I could do my clinicals, and I did complete successfully over the 300 hours required for the pathway 2. I think I did 400. I enjoyed it so much. So I ended up quitting my job in 2023 and study for the board for the IBCLC exam that I passed in December of that year. So I'm a new IBCLC, and I just got my first job in February with the week office here in Broward. So the office where I work, we are out of the county of South Florida. We are the one with the highest rate of breastfeeding. So the joy I have in this job, I would say it's a daily thing where I feel like every mom that I speak with, they learn something from me, and I can see on their face, like when they learn something new, even when it's a mom who decide that she doesn't want to breastfeed, or that she said, well, I'm not gonna breastfeed because I don't have milk and my mind is set. But the information that I can give them, what they can learn, the possibility, and I always tell them, this is information because I want you to be able to make a decision on your own and not say later, I wish I had known that. So this is something that I enjoy. I just started really because I was in training, and this week was actually my first week doing solo with patients. But it's a challenge, and I really, really enjoy it so far. Also, I would say that the challenge also is the population that we have of immigrants here who assume that formula is better because it costs money. So if I get it for free from WIC, that means it's a good thing. Back home, I remember there was a lot of campaign for breastfeeding in my country back in Haiti, and people could not afford formula, so they would breastfeed. Now people feels like, oh, this used to cost so much money back in my country, and now they give it for free. So this is all the challenge that I identified so far, and I try to educate people about, the benefits of just getting that free breast milk that is better. I mean, it's organic and all that, so I try to sell it like this. What else could I say? There's so many challenges and joy, but I don't want to be too long, so if you guys have any questions, so feel free. And also I wanted to say that till today, like Michelle, Dixie, Rachel, I will text them a question that I have and they would answer. So I feel like I'm still connected to them. So really that proves that they're not just in there for just teach you and then kick you out of the door, but it's like a network and we stay connected. Like 2 days ago, I text them and they answered right away about the question that I had. And that feels really good knowing that they're all the way there and they're still supporting me.
Okay, any burning questions for Nadej? You can raise your hand and just ask. Speakers can ask each other questions too if you want to.
Jordan?
Jordan, did you have a question? You're still muted if you did.
Oh, no, I didn't have a question.
Okay. All right. So Nadej, can you put your contact info down in the chat so people can get in touch with you?
Yes.
And then you're welcome to hang out with us as long as you feel able to. So thank you. So Maria, do you want to go ahead and introduce yourself? Tell us where you are and tell us about your work.
My name is Maria McKeegan. I'm an IBCLC. I'm in North Carolina. I work for UNC Medical. I've been there for a year in January. It's a big change. It's a really big hospital. I'm coming from California, from a small standalone hospital, a community hospital. So we see a lot more people here. Just a little bit background. My background is in child and adolescent development. I've been in lactation since 2014, so 10 years this year. As an undergrad, I stumbled on it. I had no experience with breastfeeding. I had no children. My sister didn't breastfeed. My mom didn't breastfeed. No one breastfed. So it came up as an elective. I needed to finish some electives, and they're like, my director said, there's this new course for lactation education. And he's like, I think you're a great fit for it. You should try it. And the professor just blew my mind, just all the information and all the wealth, how it also like pertains with like child development and like the rearing of the child, the skin to skin, the benefits of breastfeeding and that bonding with that mom, with their mom. I just thought it was so beautiful. And then what really impacted was how formula companies were marketing to these third world countries, right? And these babies are dying, getting sick because they don't have the means to afford formula, right? But they're marketing as you're raising smarter children. So I came into it wanting to be like an advocate. And I think as an IBCLC, you're always an advocate. You're always advocating for that mother and that baby dyad, and you're advocating to protect her milk and to protect that baby's gut flora. So I feel like after 10 years of being an IBCLC, I'm still an advocate for that. I started when Baby Friendly was coming around as a new IBCLC. So I got hired. I got really lucky. I graduated. I became an IBCLC. I got hired to the Presbyterian family. I was there for 8 years. I helped them become baby friendly. We everything was from scratch. Their rates of breastfeeding were at 4%. So they were the lowest in California and in our region, like the very lowest. Nobody was breastfeeding here. So the policy, the changing the physicians, the nurses, it was like an uphill battle to get that baby friendly designation at this hospital. So speaking of challenges, there were so many challenges, like nobody believed it, but you just have to show the information. You have to show the science behind it. The evidence shows that this is what these babies need. This is what these families need. But slowly but surely, the culture starts to change, right? More physicians start to advocate, making your job a little bit easier. More nurses start to see, oh yeah, this is better. This is healthier. This is possible, right? Formula is not this almighty like miracle syrup, right? That's going to take care of everything from sugars, like changing like the fact you don't, because a baby has low sugars, you don't automatically go to formula, right? You check the mom if she has expressible milk. We have other tools in our belt that we can go to. So it's just always protecting that gut formula. So now my job here that I moved from California to UNC, I'm doing a lot of NICU with Sonia. So there's a lot of battles to fight to make this NICU more baby friendly for these moms, getting oral immune therapy started because it wasn't happening. And I wasn't aware because I'm coming from a small hospital where oral immune therapy just automatically happened. We didn't have, so here in UNC, we have a nutrition room. So that nutrition room hoards all of the milk until they get a certain amount, then they start giving it to the babies. So we're trying to change that culture to get that that milk to those babies that they absolutely need in those first few days. So you don't lose the passion. It's been 10 years. I'm still passionate about what I'm doing. I'm still passionate about these women. I had a NICU baby. I had my own hurdles with breastfeeding. It didn't click right away. So after having my baby, I feel like I have a little bit more compassion for these NICU moms because you do not want to leave these babies. And the main thing that you can do is really protect your milk and, you know, focus on that while the doctors focus on our kids. So it's a very rewarding job. I love it. I've loved every minute of it. And it is challenging. It is challenging to change people's mind, especially if you've been doing something a certain way for many years. But it is possible with persistence and showing evidence-based information. And yeah, it's possible.
Great. Thank you.
So unlike you, like the other, like it's not so much that people don't want to breastfeed. Now for me here where I'm working at UNC, everybody wants to breastfeed. It's now like, let's not start supplementing you so fast. Let's protect it. Let's work on it. Yeah.
Great. One of the audience folks was asking about oral immune therapy, and Michelle put some stuff in the chat. You want to talk about at UNC, how that works at UNC?
So with our NICU moms and at UNC being baby friendly, we try to get them pumping or expressing within 6 hours of birth. So within those 6 hours of birth, we either teach them how to massage their breast, how to hand express, and how to properly use the pump. And we collect, because you're not getting that much. So you either collect it in like a 1 ml syringe, you fill it up to like 0.2, or we can collect it in a swab, and that immediately goes to the baby, and it goes inside the cheek. So now that baby is getting those nutrients from mom.
Thank you.
Yeah, and it wasn't happening at the hospital till Sonia came and was like, "What's going on?"
Right. All right. Okay. Well, I think you all sound like a very dynamic duo. I'm sure you've got other peers to work with as well. But
Yeah, she's
thank
getting
you.
everybody really excited. Yeah.
Pumped up. Thank you so
Yeah.
much. And again, if you could put your contact information, Maria, in the
Yeah.
chat for folks to be able to contact you if they have other questions, that would be great. So anybody else of the speakers, yeah, any other questions for Maria? And then we're going to poll the rest of the speakers. Who has a question?
I have a question, Dixie,
Great.
for Maria. So since you've worked in a couple different states, did you have to go through any other certification processes to be able to work in North Carolina versus California?
No.
And you're not an RN, you have your
No, I'm not an RN. Yes.
Okay.
Not an RN. Been lucky enough to be able to find work without being an RN.
That's
And
encouraging.
in North Carolina, it's a lot harder than it is in California.
Okay.
So make connections. The lactation community is a very small community. My mentor in California actually works at UNC. So when I was moving over here, I reached out to her. So we're a tight-knit group.
Yeah, that's very good advice. So get involved in the lactation community, even if you're not a lactation consultant yet. Great advice.
Yes, I started getting involved even before.
Yeah. Yeah. Okay. So of the other speakers, is there anybody else that feels like they need to go ahead and speak right now because they're going to need to leave a little bit early? Anybody feel like, oh, I want to go next? No? Okay. Well, thank you. So I'm going to go to, let's see, let's talk to somebody who's got a completely different combination of skills. How about you, Julia?
Sure. Hi, I'm Julia Farrell. I am an occupational therapist and did that first for, gosh, what, 22 years before before I found Dixie was teaching at the time and the program at Portland State. I was living in California. I had been a feeding therapist in mostly working with NICU graduates. And when I went to OT school, we mostly learned bottle feeding and didn't learn a lot of breastfeeding. So I had so many families that wanted to breastfeed, and they had babies that had feeding difficulties and I didn't know how to help them. I worked with some lactation consultants there, and then felt like I should really know some of this stuff. So I found the program and came up here intending just to do the 90 hours of coursework so that I could puff up my knowledge. But I think some of the things that the other speakers so far have said really drew me to want to do more with lactation. And that was the people that I met in the program. I had never had, coming from a medical therapy background, never had a an instructor or a community of people that were so welcoming and supportive and collaborative in a really unique way, in my opinion. And so I was hooked and I moved to Portland and did my level 2, or the second part of my experiences here for my 300 hours of coursework. Lucky that I had the ability to do that and found a job here. So currently I work at Oregon Health and Sciences University in the CDRC, which stands for Child Development and Rehabilitation Center, part of Dornbecker. I am one of their feeding therapists and one of 2 lactation consultants in our group. And I don't get to use my lactation skills as often as I would like, but I do use them quite a bit. I'm also in a post-professional doctoral OT program, and I just did some research on OT's role in working with medically complex breast and chest feeding dyads and presented at our national OT conference. So I'm leading the charge, I guess, in the OT world to talk more about lactation, and I get to use my skills with families and who would otherwise have a really hard time doing any breast or chest feeding because of the level of medical complexity that they're dealing with. I'm seeing kids that are six months and older, usually, sometimes a little earlier, 4 months adjusted or something like that. So they're not brand new nursing dyads. They might be trying to get back to the breast after not being able to breastfeed. The biggest challenge for me where I work is that the parent is never my patient. So I don't have, I don't have maternal health records. I can't chart on the family. So I cannot really be working as an IBCLC. So I consult a lot with people in the community for that piece. I'm really having to focus more on the baby side of the dyad in terms of my actual treatment. Technically, you're never just treating a baby. You're always treating a dyad. So, or an entire family often in my world, because we're working on more than just breastfeeding. But I love what I do, and I wouldn't have it any other way.
Well, thank you very much. And I think Julia is just a great example of how you can combine an IBCLC with other credentials and then be able to use that information in the work that you're already doing in one way or another. And then again, add to that collaborative community out there to support families in whatever way we can, in whatever setting we're in. So thank you, Julia. Yeah, if you want to put your contact information in the chat, that would be wonderful. And so let's see, Ashley, I know we have 2 Ashleys. How about Ashley Pittman Hayes going next? Because you work in a different setting as well.
Hi, yeah, I am Ashley. I did Pathway 1. So after I graduated, being a nurse, I kind of really focused on doing this while I was working in public health. So right now, and I also was doing this back in 2014, so I've been doing it a while. I started out at the public health department doing maternal child health. I was doing some stuff on like our prenatal clinic floor. And then I'm doing, it's called Babies First in Cocoon here in Oregon. So seeing families prenatally during pregnancy, as well as kiddos 0 to 5, and then kiddos with any special healthcare needs, 0 to 21. So doing a lot of case management and feeding for that. And sorry, I have kids out here too. You guys need to go back to bed.
All this, Mom, all this
Hold on,
evening,
give me a second.
we were watching Pop.
Okay, sorry about that. And so I did my nursing practicum with the health department, and so I got a lot of hours through that. And then when I went on to do my bachelor's in nursing through OHSU, I was able to get my practicum at Riverbend specific to lactation. So that definitely helped getting those 1,000 hours in. And then I was just doing lots of trainings to get my 95 hours. I did some evergreen training out of Washington. I think it's with Molly Pessel. I took some graduate coursework through Wichita State. And then just kind of doing whatever I found that I could, and work was helping pay for that, which was really nice. Yeah, and I just kind of, I mean, I didn't have any kids and I was really young, and so it was all kind of new, but really interested in learning more and helping families. So right now I'm doing the same thing. It's just not through the health department. It's through like a community action network. And so I'm doing that. So I do home visits, and I am also able to see people in my office. I can go see people at the hospital as well. I kind of see people really anywhere. So some of the challenges come with people that are unhoused, living in their cars. So that's definitely, I feel like, one of the biggest challenges is working with families that don't have a whole lot of resources, and or are really rural, because we're really rural. So finding referrals, like say to OT, if they don't qualify for early intervention services, which is 0 to 3 for like the PTs and the OTs, it's really hard to kind of get families to come in and see those extra, resources that they may need. Some joys are working with early intervention. So I get to do a lot of joint visits for those kiddos, working with the PT and the OT. So I get to learn a lot from them. And let's see, I do a lot of things, I feel like. So I'm the coordinator of our local breastfeeding coalition as well. So we do lots of events. We host big latch-ons. I sit on like a bunch of committees, so I really get to share about lactation where it may not always be present in certain things, and especially like for our insurance, like the local CCO. Please stop. Okay.
But all of a sudden people watching Paw Patrol.
So sitting on like the board of the CCO is really helpful to kind of educate other providers about just what we do and how supportive we are. And I know somebody mentioned in here that they're a doula in the chat. And so we're really working with the doulas and seeing how we can coordinate with them. Let's see what else. Right now, we are just working with OHSU to start doing a breastfeeding assessment of our area with the NIGHT, the Cancer Institute, and trying to figure out that. So I'm learning all kinds of things. I've never done like data work and assessments. So really partnering with them to kind of figure out how to do that, as well as writing grants to get funding to do that. So I feel like the last couple of years taking on the coordinator role of the coalition has taught me a lot. And I'm learning a lot. And then just a joy that I really like is being in the homes with families. Like it's totally different than being in the hospital. And you're going through so many different things when you're at home. And even like working on weaning and things like that as kiddos are getting older. So I think I covered all of that. If anybody has any questions.
Yeah, anyone have any questions for Ashley? Wow, such great variety. And that happens sometimes when you're working in some of those more rural communities. You get to wear many different hats, which can be challenging and interesting at the same time. That's great. And it sounds like you also get to work with the other people who are breastfeeding advocates in your community. So that's wonderful. Well, thank you. What a different kind of setting. So yeah, if you can put your contact info down in the chat for us, Ashley, thank you. Okay, well, I think we're going to go to Alexandra next, and she can tell us a little bit about her setting.
Hi, everyone. I'm Alexandra Mitchell. I am in IBCLC. I'm a nurse, and I'm also a nurse midwife. I did Pathway 2 actually, and I did my 90 hours of education at Portland State with Randy and also with Julia. Hi. And yeah, Dixie as a teacher as well. When I enrolled in the Portland State program, I was actually in my BSN program at the same time, which I do not recommend. But it was a really great experience. I was going to school in Idaho, so it was remote, and then I would drive for our in-person weekends. And then I graduated from nursing school. I worked for a year in Boise, and then I moved back home, which is the Bay Area, San Francisco Bay Area. And I got my hours working at WIC, East and West Oakland WIC, with my mentor. Her name is Brandy Gates Burgess, and she started a community group called Breast Friends. And specifically, it was to support the Black breastfeeding community here in Oakland, which has had a few different iterations at this point, but very, very great group. I learned a lot. And I also did some of my hours with her as well at Highland Hospital, which is the county hospital here in Alameda County. And then I finished midwifery school in 2022, and I passed my IBCLC exam in 2021. And towards the end of school, I actually ended up getting a job at Kaiser as a lactation consultant, and I'm still doing that part-time. So I work on the mother baby unit at Kaiser in Walnut Creek, and we do acute assessments, we do latch support. We just rolled out our donor milk program. So it's been great, actually. Super, super fun to be a part of, and be like a breastfeeding champion, and using the donor milk and offering it and warming it up and thawing it and being in contact with the milk bank has been really cool. And then as a midwife, I'm working part-time at San Francisco General Hospital. And so, yeah, I attend births. I do postpartum and antepartum care. And yeah, some joys. My biggest joy is working. Most of the time for my job, I'm like, I would say 90% of the time I'm speaking Spanish. And so that's been really great, is to work with the Latinx community here, and also the Black community, since I'm working on a county hospital, because those are where the breastfeeding rates are the lowest. So I really feel like everything that I dreamed about doing as a lactation consultant, I've been able to do. But it's been a little challenging working as a midwife, because I had hoped, and I think there will be opportunities to be creative around this, but I really, really want to make a change in how we deliver prenatal education around breastfeeding. Since we have only 15 minutes per visit, we kind of outsource that task to our health educators, who are great. But being an IBCLC, I think it's a dream of mine to just offer maybe like an hour-long appointment just for breastfeeding. So that's what I'm trying to work on. And yeah, I think that's everything. Just wondering if you have questions.
Thank you, Alexandra. I had forgotten that you were in class with Julia and Randy. Oh, that's great that you all get to see each other again and close that circle. And yeah, so thank you for, again, just like the wide variety of things you're getting to do. That is just amazing. So wonderful. Let's see. Okay, how about the other Ashley? Oh, and Alexandra, please put your contact information in the chat for us. So if anyone else wants to get in touch with you. So our other Ashley, tell us about your work setting, how you became IBCLC.
Hi, I'm Ashley Treadwell. I am located here in Portland. And I think I can probably provide a little bit of a different perspective. I don't have a history at all in healthcare. I came to my education, I worked in HR and recruiting before I decided to become a lactation consultant. I did the program at UCSD in 2013. It was a hybrid program. So I did the 90 hours of education and then the 300 clinical hours. And we had clinical sites there in San Diego. So I did my clinical hours. I did it on a postpartum floor in a hospital, and I did an outpatient clinic in a hospital, and then a little bit with a private practice lactation consultant. And I remember as I was going through my education feeling some concern about the fact that I didn't have any background in healthcare, you know, that I'd worked in only recruiting. I remember thinking to myself that I'd never touched anybody professionally. Like I'd never worked in a job where that was part of my job. And I felt, I think, a little nervous and that maybe I wouldn't be prepared. And the education that I did through UCSD, which it sounds like the programs are very similar, and the clinical hours and the clinical supervision that I had absolutely prepared me. And I have really been fortunate. So for the 11 years that I've been working as a lactation consultant, I've worked in private practice. So I've worked for myself. I did a few years in San Diego, and then we moved up to Portland in 2016. And I opened up a private practice here. So I've been working in private practice in Portland since 2016. I do a combination of home visits. I work in a birth center providing lactation care for their patients. And then I also work in a chiropractor's office seeing patients there. And yeah, the longer I do my job, the more I love it. I don't think I realized, somebody said something about the passion growing, and that is something that I've found. I feel really happy to have a job that I say it to people and I'm not kidding. Like I pinch myself every day that this is what I get to do for a living. I also really appreciate hearing about, so many of the other speakers here talking about their experience and the advocacy, that people are doing at, hospital levels and county levels and, coalition levels and state levels. What I see in the work that I do and working with families is that, our system is really broken. Like we're really broken. Our system is not set up to support families, I think, to be able to easily and exclusively breastfeed their babies. And I think what I find is the people who end up suffering are the families, the parents in particular. It's kind of what's a society problem. I think it ends up being really the blame and the shame and the frustration ends up with the families. And my heart goes out to them. And I think I appreciate the advocacy that's done. And what I've seen my role as is kind of being on the ground and working with these families one-on-one and helping them feel better about how they're feeding their babies within the reality of their life and our society, and having to return to work and not having, big support systems, and just on the ground helping them feel better about how they're feeding their babies, so that can feel like a good part. Because as many of us know, who have either done it ourselves or those of us who are supporting families that are doing it, it can be a really, really difficult thing. And so that's something that the longer I do this, the more passionate I feel. I've done some additional training in mental health. That's something that I feel really, really passionate about, is that, that I feel often the mental health of parents can really suffer in those initial postpartum periods. So I've done some additional training and I'm in the process of getting an additional certificate for that. So yeah, I think I can, like I said, I can provide a little bit of a different perspective, and not having that, the medical background or the healthcare background, but have been able to really find, my way and be able to do this work that I love. So yeah, thanks for letting me share.
Wonderful. Just another example of a completely different setting. And, again, all of us, I think, are starting to recognize the need for additional training related to mental health. And in the role of a lactation consultant, we often work with families at that really significant time. And we work very intimately with them usually. And so we can, if we are well prepared, we can provide great support for them. So yeah, I really hear what you're saying. So thank you for sharing that. So yes, Ashley, please put your contact information into the chat in case any of the folks here want to contact you. And thank you so much. So we're going, I think our last speaker tonight is Randy. Take it away, Randy.
Awesome. So my name is Randy Scrima, and I live in Boise, Idaho. And kind of a little background on how I became an IBCLC. I was finishing up my bachelor's degree, but I was kind of at a point in my life where I didn't quite know what I wanted my degree in because there was so many different things I wanted to do, and I couldn't pinpoint what exactly I wanted to do. And I wanted to make sure I was making the right decision because, you know, I wanted to either be a social worker, a psychologist, or a teacher or a nurse. And I just couldn't make couldn't narrow it down. And kind of at the same time, I also had my son and ran into some breastfeeding difficulties with him. And kind of the more I learned about breastfeeding going through with him and, you know, the great benefits of breastfeeding and all of that, it just all kind of came together where I was like, you know, this is exactly what I want to do. It encompasses basically everything that I've been wanting to do. And so this is it. So I looked into, you know, the different programs that were available. And one thing I really liked about the Portland State program was they were willing to work with me to find sites where I lived in Boise and where I could get my 300 hours in. So I was also a big fan of, you know, visiting Portland just for fun. So I didn't mind coming every quarter for the weekend classes and just made like a family event about it. And so I finished up my degree and finished up my IBCLC, and kind of it all came together. I saw as I was finishing, there was a job opening for WIC and in my city, and I thought, you know, this is perfect. I've wanted to work with low-income people, and I think this will be a really great fit. And long story short, the job ended up being with the state WIC office. So it's more of an administrative role as the breastfeeding coordinator. And that was even better for me since I'm a huge introvert. I don't have to work with clients directly. I work with the breastfeeding coordinators and peer counselors and peer counselor coordinators that are all around the state. And my role is to more of education, making sure that they have the information they need to help serve participants. And also, you know, making sure that the federal dollars, since WIC is a federal program, they're abiding by all the policies. And so, you know, we read the federal policies and we turn it into state policies and make sure that the agencies have their agency policies. And so that's kind of a big role in it as well. And I think one of the joys of the job that I do is that I really love working with the clinicians that work at the local agencies, and they're always very appreciative at, you know, knowing that they have the support that they need in order to do the job that they're doing. But also a challenge is since it's a federal program, there's a lot of things that are required. And so like breastfeeding is one part of it, but then, you know, if there's a new program coming out, like when we went from WIC checks to cards, you know, my role kind of had to switch from, you know, being the majority breastfeeding to help with this huge giant project. So although I get to do a lot of the fun stuff, like, you know, give funds to the local agencies and say, here, you can use this for, you know, different lactation trainings or different, you know, books for participants and all of that. that's a really great part of it. But then also, I have to do some of the stuff that I don't enjoy quite as much. So yeah, that's my story.
Okay, so, well, thank you, Randy, and please put your contact information in the chat. Any specific questions for Randy? Yes, we're going to take a moment now, and questions for any of the speakers that are still here, because I'm going to be pulling up some slides to talk about our program, but I want to be sure that folks that are here get their questions answered. So either use your mic or be sure and put it in the chat.
So there was a question earlier about where can one get volunteer experience while waiting to get into a program. Maybe you all can answer how you did that.
I can jump in and say I know that I started attending the Leche League meetings, and I also was looking into seeing if I could become a peer counselor with our local WIC agency. That's a really great program that kind of is a jumping point to start off in. And then I also became involved with my local my state breastfeeding coalition.
My question is kind of broad for the folks who didn't have the traditional medical background prior to this path. What was the biggest challenge? I'm also coming from the corporate world, and Ashley, I know you said you were in HR. What was the biggest challenge making that transition in life? And is there, I guess, just any advice you would give?
Yeah, that's a great question. I mean, I definitely, like I shared, I definitely had some concerns about moving into, a role where I was going to be providing kind of healthcare. I think I was really fortunate with the clinical sites that I was able to, that I did my clinical hours in, really providing me with a lot of hands-on experience, which was really helpful. I was really nervous the first time I put my finger in a baby's mouth, and, I just did it 6 to 7 times a day, every day I was there. And, like anything else, I tell people, it's like when I talk to parents about feeding, the more you do something, the easier it feels. But I think it's, there are so many different components of lactation. There is a clinical component, there is a counseling component, there's a coaching component, there's an investigative component. And so I think that's what is so great about it, is that while it is, a healthcare and a medical, field, it's so much more. Somebody mentioned, like, I think some of probably the only healthcare providers that work with 2 patients every time we work. And so I think skills coming from a corporate world, I think, will absolutely serve you. And the clinical skills will come. Like, clinical skills can be taught. Those are things that can be taught. And I think just trusting that by choosing, the right program here, that you'll get those skills.
Thank you.
And yeah, I want to add, think about all the folks that go into any kind of health profession. Many of them have not had any healthcare experience. People becoming nurses, people becoming doctors, people becoming all sorts of different health professionals. So that's the whole purpose of good clinical training. And so that's the other thing to think about. And I think the thing that I love about what our program provides is we give people the opportunity to really work closely with and under the direct supervision of IBCLCs. So they're going to do more than the required 300 hours. So they're going to get that great experience, as well as be in classes with Rachel and their cohort, where they're then debriefing, really thinking about and talking about the clinical experiences that they're having and learning from each other's clinical experiences as well. So hopefully that does prepare people well for their jobs.